Well, Australia's going through a health transition where we're moving from a treatment system in hospitals biased to acute expensive settings through to care in the home, care in GP practices and investment in prevention. So we're looking at investments across those dimensions with what we call the health transition. So we're investing in models of care for the future and not the old model. So when we look at the opportunities in those markets, there are some significant areas for potential investment, and our pipeline, remains strong. But we will remain disciplined in growth in those sectors because, we're looking to invest in companies that deliver value for our shareholders, but also help strengthen our private health insurance proposition for consumers and help us manage the resilience of the business. But as I said, there's lots of opportunities in health. It's a growing market, but really interesting time for innovation in the sector, and that's what we're investing in for the future.
David, you've highlighted some of the challenges in healthcare in your report here. And, as a reporter back in Australia, I covered my fair share of those, with everything from ambulance ramping to, the doctor shortage in the countryside. When you talk about this health transition, I did notice, I picked up on that, and I wanted to unpack that a little bit further because you have said that it is advanced in other parts of the world, with Australia trailing many countries in the uptake. How so? Because Australia is considered fairly advanced as far as the healthcare sort of system is concerned. And if that is a worry, or at least something that you're trying to address, are you lobbying the government? What's your relationship there?
Yes, there's no doubt that we have one of the best health systems in the world right now. My concern is that we want to keep the Australian health system one of the best health systems for the future. And we are really struggling as a system to drive productivity and innovation. We are well behind in Australia in the adoption of new ways of delivering care, whether it be at home, whether it be adoption of virtual healthcare, whether it be our relative investment in prevention. All these things are part of the health transition that we really need, and we simply can't go fast enough. Otherwise, we won't be able to afford the health system of the future and put even more pressure onto the public system that's already stretched. Health demand is increasing because we're getting older, and unfortunately there's an increase in chronic disease. So we are investing in this future. I'd say that the discussions we're having with the government and all sides of politics and the department are that this is a well understood issue, and we've got to work together because this change will be complex and will be slow.